Hello, my name's Ian McCall. This is a video on behalf of the Australian Institute of Dermatology and Consultations in Dermatology. We're going to look today at what's called acne keloidalis. Now, this is a relatively mild example of this. You can see these small papules at the base of the neck. The history from this patient was that he worked in the mining industry, and he wore a hat that tended to rub in this area, and that he'd get recurrent small pustules here which would subsequently heal and form these itchy lumps. Now, acne keloidalis would suggest that the condition's got something to do with acne, with blockage of grease glands, with blackheads and comedones, and the keloidalis suggesting that it's a keloidal scar. Now, it is a keloidal scar, but it really doesn't have anything to do with acne or the normal causes of acne, because this is a chronic staphylococcal folliculitis. It's a staph infection, and it's not just a superficial staph infection, involving the infundibulum. It often causes rupture of a follicle, so you can get a furuncle, and a result of that is the acne scarring, the keloidal scarring, I should say. This condition is much more commonly seen in African Americans. Well, by the way, I've commented there that usually they're hypertrophic scars rather than true keloids, but not always. I've seen keloids in African Americans who get this condition. It's more common in obesity, and this was an overweight coal miner. So that's probably played a part in this. We've said here that to use some minomycin, but really you want to do a swab, find out what the antibiotic sensitivities of the staphylococcus are, and choose your antibiotic from there. Minomycin acts as an anti-inflammatory as well as an antibiotic. Let's have a look at perhaps more classic examples of this condition. This is more the picture that you're likely to see. You can see that there's certainly scarring here. There's loss of hair follicles. You can see the abscesses that have formed. You can see the inflamed, infected areas here with a hair follicle coming out of the middle of them. And these are thickening up to form hypertrophic, perhaps keloid scars. So this is the sort of thing that can happen in a good going case of acne keloidalis. And really, you need a month of appropriate high-dose antibiotics to try and sterilize this area. Paradoxically, sometimes retinoids, isotretinoin, orally, like Roaccutane, just as you would in acne, can actually help in this condition as well. Let's have a little look. What others do we have? This is a close-up of another one, milder, but you can see the inflamed papules occurring in association with hair follicles in this particular condition. There are some better examples, I think, in Global Skin Atlas. Let's look at this one. I think it probably better shows the type of hypertrophic or keloidal picture that you get. We're only seeing the end of this here. I can't really bring that one down. Bear with me, let's try another one. Again, this is more the picture that you see when you're African American, just with that type of hair, and you can see the degree of scarring that you're getting here. 45-year-old male, 4-year history of papules over the nape of the neck. Became pustular, keloid-like plaques, symptoms like itching and excoriations over the plaques. So again, antibiotics, sometimes oral retinoids to get this to settle down and to stay settled. And sometimes we'll use a topical antibiotic like clindamycin lotion to deal with any tendency to get recurrences. In the case of our miner, with his hat rubbing on this area, again a different type of protective helmet would help. But African Americans are particularly susceptible to this condition of acne keloidalis. I don't know if there's much say in the archives recently on this topic. Let's just have a quick look. God bless them. Surgical management. Sometimes, you have to try and excise this because of the chronic sinuses that may form here. If it's been there for quite some time, you get the equivalent of abscesses that go deep there, and surgery might be needed. Again, they're just referring to it there as a form of primary scanning alopecia. No. Nothing else there. These are the main things. So not a lot's been is new really in the main journals on this. So just to get back to our original case, as I say, he was managed with some minomycin, and we told him to try and get a different type of hat so he wasn't getting rubbing on this area. But you can see that's a relatively mild form of this condition in comparison to what the African American patients can get. Thanks very much.